So you or your family member has had an open heart surgery and you are wondering, how in the world am I going to move after having my chest split open? Well, this video is going to be for you. What's up, y'all? This is Carolina Doc PT, and today's video we're talking about patients who are recently out of the hospital following some sort of open heart surgery. So open hearts can be for a variety of different conditions for the heart, but usually the recovery for those patients is going to be very similar, and so that's what we're going to be talking about here. So one of the first things that you're going to want to know when you come home after having had an open heart surgery is you're going to want to be thinking about what are your sternal precautions. So when you're in the hospital, they should have given you some motions that your chest and your arms should not go through, because to do so would endanger the opening of that surgical incision that your surgeon closed. So what those motions look like are basically, you're not going to want to spread your arms open, okay? So you're not going to want to reach out to the sides. You're not going to want to reach overhead. Both of those are going to become an issue when you're thinking about dressing and putting on shirts. So you're likely going to want to have a shirt that maybe has buttons, and you're probably going to need to use or have the help of a family member to help you put clothes on and off. But putting on a button shirt usually works pretty well for that purpose. You also generally are not going to want to lift somewhere between 5 and 10 pounds. The surgeons kind of differ on that one a little bit. I generally will tell patients, if it's a gallon of milk is too heavy. So you're not going to want to lift with that as far as following those sternal precautions. And you're going to want to be able to keep your arms within essentially a box. So if you had your elbows kind of at your side, like I'm doing now, anything within this box, like about a 1 foot by 1 foot box in front of you, anything in here that's not lifting, you can do. But if you're going to go outside the box and you're going to be reaching for something, reaching forward, reaching overhead, getting something out of a cabinet, those are all motions that you're not going to want to do because you're going to violate the sternal precautions. That's not to say that your incision is just going to, bust open just because you've done those motions, but it just helps. It just weakens that area, and you want that area to scar down really well. And so anytime you're going into those motions, you're just pulling on an area that doesn't need to be pulled on, and we're trying to really prevent infection. That's one of the big things that can happen if you're violating your sternal precautions and the incision doesn't completely heal. Then it's possible to get an infection inside of that area, and that leads to not good things. Believe me, I have seen patients like that and have had some personal experience with family about that, and that can be a life-threatening situation. So you want to be sure to follow your sternal precautions so that area heals. You're also, within those precautions, like I said, not going to want to lift anything that's going to be over 5 pounds. A gallon of milk is generally the example that we generally use. You're also going to want to use the chest pillow that the hospital will send you home with. Most of the time, the hospitals around here, they will give patients these pillows that look like a heart, and they're supposed to walk around just putting that on the front of their chest as they're moving around, as they cough, that kind of a thing. That just helps to provide some external support to that surgical incision, so that if you are coughing, it doesn't put strain the muscles there between your rib cages too much. Just that little bit of external support can help. Also, it helps as far as pain goes a little bit, that type of a thing. So you're also within those sternal precautions. You're not going to want to push off. So this is the one thing that becomes tricky. So going to stand up out of a chair, you're not going to want to use your armrests and push up, because you can see again, you're going to spread your chest out, which you don't want to do that. And then just pushing up can be too much for that surgical incision to help it to heal and fully close. Really the trickiest point though will be getting into and out of bed. So before you come home from the hospital, the physical therapist and PTAs there should have taught you how to do a log roll. That's where you are lying down onto your shoulder and lifting your legs at the same time to get into the bed, and then coming out of the bed, you're going to want to do the same thing. You can't, though, use your arms to push up. So that's what makes getting in and out of the bed tricky after these surgeries. So if you are a smaller person and you have a larger family member and they can help to get you into and out of that position in your bed, then, you can give that a whirl. But most patients, because of the difficulty of that, they're going to come home from the hospital and they're going to want to just stay in their recliner. A lot of patients that are post-surgical heart patients will like sleeping upright, sleeping, well, not fully upright, but, in a recliner. It helps to get better breaths. If you're lying flat on your back, it's actually a little harder to take a deep breath. It certainly is harder to cough, and you don't want to get pneumonia or anything like that. So that's where coughing is gonna be beneficial, but with the chest pillow. So another thing that you're going to come home with after this open heart surgery is you're going to have an inspirometer. For that inspirometer, I've done some videos on that. You can look at my video that I did on pneumonia and preventing pneumonia. So I show what the inspirometers look like and how you use them. So those inspirometers you're going to want to use multiple times throughout the day, just because, again, you're trying to prevent pneumonia. And so it just will help to facilitate taking a little bit deeper breath and coughing. But you are going to want to use that chest pillow to kind of help with providing some external support to that surgical incision down your chest. So that's all just kind of related to sternal precautions and taking care of that. You can typically shower with that, but you're going to want to put a press and seal over top of any surgical dressings that they have there. And then you're going to want to stand just out of the stream. You're not going to want to stand like with the shower head just pounding on that surgical incision, because let's say that you wash your hair, because you can get your head into that box that we talked about, or maybe you have your spouse or whoever get in the shower with you and they're washing your hair. Well, if that runs down, you're talking about microscopic bacteria that you're trying to prevent. So say it washes out of your hair, but then it runs down, and if that seal is not perfect around the dressings that are over top of that incision, you risk getting an infection, and believe me, you do not want to go down that route. It leads to not great things. But the taking a shower, if you're not going to soak it, so put press and seal over the area, turn your back to the shower. You can wash lower body, maybe sponge bath on the top, your upper body, or just a direct stream, get a shower head and direct the stream away from the incision. You're definitely not going to want to get the dressing, even with press and seal over top of it, even if you have a or a water resistant dressing, you are still, or water resistant or waterproof. I always get those two mixed up and confused. But either way, you're not going to want to direct the shower head onto that area. But can you redirect it in other areas? Sure, I don't see a problem with that. You're not going to want to sit into a bath. You're not going to want to certainly get into a hot tub or a pool or anything like that, because you can get infections. When you first come home after this open heart, you're not going to want to put heat anywhere near that incision. Putting ice there would not be not be bad. That if you were having some pain, that would be my modality of choice to try to help with that pain. And you're, again, with those, I did some videos on that as well that you can look, that I might link it also to this video, or that you can see in my video playlist that show you how to use ice. You're going to want to stay away from heat. You're going to stay away from a contrast bath where you're using heat and ice. You're going to just want to use ice for the first several weeks, or first week or two of that, until that's healing up, and then you can start to progress to heat a little bit after that. But you want that, I think you'd want that incision to get closed, just because you're just going to keep irritating it, because that's an area that is going to naturally move a lot because of your rib cage, and so you're breathing, and so you can get inflammation in there really easily. And I would use ice preferentially for the first several days to a week or two, really and truly. So these are all the things that we're talking about as far as just some initial thoughts on sternal precautions, which you really want to think about, and then also taking care of that incision. You also are going to want to be using a walker if need be. If your balance is at all questionable, you're going to want to use a walker or a cane. Whichever. Again, using both hands and needing to, using a walker can be a little bit cumbersome because of carrying the chest pillow, but, it may be that you need to sacrifice one or the other, because if your balance is too bad, then you definitely need to be using the walker. You're just not going to want to lean on it very much. You're just going to want to walk with it, maybe holding your hands and just kind of gripping it and having the walker move along with you, but not just leaning on it. But a cane is going to be most patients' preference if they have a little bit of instability when they're walking. So then that way they can hold the chest pillow over top of the incisions, but then also use that cane a little bit. But again, even with that, you're not going to want to lean heavily on the cane, because that's going to, again, violate a sternal precaution. So everything that we've talked about, we would chalk all of this up into safety and protection. So you're wanting to protect everything. You're not wanting to overdo the area of the incision. That's where the sternal precautions come in. You certainly don't want to have a fall or anything like that. So after you've thought about the safety and protection, really the next step from a physical therapy standpoint, and I'm going to say is obviously going to be exercise. You've got to move. The worst thing that you can do for yourself after this type of a surgery would be just to sit in that recliner and not move. But you just had a heart surgery. What is the cardiac system doing? It's helping to pump blood out so that you can move, so that your muscles can have oxygen, and so that they can work and move. So it is critically important that you get around and walk. That's going to be really the number one exercise for you. The PTA, when you work with them, you'll have home health come in, the physical therapist and the PTA. Usually in the future, like after that first visit will be with the physical therapist. The future visits will be with PTAs until the 30-day point, when the PT will come back to assess how you're doing, and you might discharge then or what have you. But the PTA, when they come in, they'll be working with you on more specific, like, exercises for the lower body, making sure that you are kind of strengthening your legs, because just going to the hospital and being there for a few days is certainly going to weaken you. But that PT, what I always like to do when I was in home health for these particular types of patients, is get a walking program started immediately. So I would generally recommend for a post-surgical open heart patient, you're going to want to walk every about 30 minutes to an hour. You're going to want to stay, most importantly, at a low intensity when you are moving around. Okay, now is not the time to go, okay, I'm going to get myself into shape here, and I'm going to do, I'm going to start doing hill work, and I'm going to make an exercise routine out of my stairs. That would be the worst thing you could do. So you would want to avoid high intensity type of exercises. You're going to want to preferably do low intensity exercises, and then you're going to want to do those a bunch. So I always explain to patients that we want you to do this about every 30 minutes to an hour. Get up, just stay in your house, walk. You can walk from one end of the house to the other, whatever you would consider to be an easy thing for you to do. Something that I generally would recommend. Use a scale, like say on a 0 to 10 scale. 0, you're not doing anything at all. 10, you're working as hard as you possibly can. When you're doing this exercise, I generally want you to be around about a 3, and not going any higher than that. So something that's very easy. You're not even feeling like winded at all. And so walk in your house, whatever that distance is, that's going to lead you to get to about a 3. At that point, then you're going to stop and you're going to rest. I'd wait about 30 minutes to an hour, and then I'd do it again. And then, again, staying at low intensity, whatever that distance is. And that distance may vary. Early in the morning, when you're rested, you might be able to walk a little bit more. But then as you continue this through the day, you might have to shorten that distance a little bit in order to stay around that 3 of 10 and stay in that easy range. So then throughout the day, I generally would recommend that you do this somewhere between about 6 to 12 times a day, preferably closer to 12 times a day. That's getting up and frequently walking throughout the bulk of the day, just doing easy laps in the house, and just getting up and moving. That does a lot of good things. It helps to circulate blood a little bit better. It's going to help you to breathe a little bit better. And again, that's kind of working your heart, but just in a low level range. And then over time, as you continue to go, you're still going to want to do that amount of repetitions throughout the day, but then you'll increase the distance as your body gets more efficient and you start getting stronger. You'll be able to go farther, but still staying in that 3 out of 10 range. That's easy, because your body is going to adapt to what it is that you're doing. It's going to get stronger. It's going to get better. So it'll be able to move better. So as you keep doing that, if you stay at the same distance you've always been, then the intensity level for you will start dropping down, and you'll start saying, man, this is super easy. This is like a 1 out of 10. Like I'm hardly even working at all. Okay, great. Now it's time to bump up your distance so that you get again around about a 3 out of 10. So it's something that's relatively easy for you to do. So how you want to think about cardio exercise or walking after these heart surgeries is there shouldn't be one particular exercise that is high intensity. Higher intensity work, you can't do it as often because it'll wear you out. There's also risks that come with doing higher intensity work. Instead, we want you to look at what it is that you're doing through the sum total of the day. So your work is going to come through all of the exercise bouts throughout the day. As I say, preferably somewhere between about 6 to 12. It's not going to be any individual bout per se. So like a high intensity, you're going to work really hard. It's going to be one bout really hard, and then you're wiped out. You're not ever able to do anything the rest of the day. There are risks that come with that. It also is not beneficial to just sit and just after doing an exercise bout one time. Instead, we want to work at this point. You just had a major heart surgery. We're wanting to work on the low intensity side and then repeating that frequently all day long, every single day. Then that's how you're going to build your stamina up from baseline up. Okay. And so let me also say, after this type of surgery, it's really critically important that you move. Sitting, as I mentioned earlier, that is one of the worst things that you can do, because you'll continue to get deconditioned, and you're going to have a more difficult recovery, and you're going to have a more difficult, you're choosing a more difficult path. So you got to get up, but I'm giving you a range of between 6 to 12. So use that range. I mean, there's some days after heart surgeries where you're just not going to feel real great, and that's fine. You don't have to crush it to go to 12 times every single day. There's a wide range that you want to use to recover. So if you only can do 6 throughout a day, okay, that's fine. But do treat every single day as a new day, and try to preferably do this about every 30 minutes to an hour, closer to 12 times a day. But if you need to also do some sixes in there because I just can't make 12, then that's fine. Don't beat yourself up about it. Just keep working at it. Okay, this is the type of thing that's going to come over time. It's going to take a lot of work. Is going to take a lot of work on your stamina. And also, what the prescription I'm giving you is for recent and new post-surgical open heart patients. After you've been working with home health for generally somewhere between 2 to 4 weeks, it's going to kind of vary. You at that point should be expecting to go to cardiac rehab. And I always tell patients, highly, highly recommend that you go to cardiac rehab. Home health physical therapy and even outpatient physical therapy is not a substitute for cardiac rehab. Cardiac rehab will work you at a whole different level than what we're doing with you in physical therapy. They also will do things like they'll take your blood pressure while you're exercising. Typically in physical therapy, we're not doing that. We may do like a 2 or 6 minute walk test with you where we take your blood pressure after you're finished. So that's very common, and that's really a standard type of measure that we're using. But as far as monitoring your blood pressure, your heart rate during the exercise, as far as like in cardiac rehab, they'll oftentimes hook up leads to your chest so that way they can actually see your heart working as you're exercising. We're not going to get into that. So you're going to want to go to cardiac rehab to continue to progress your therapy out of this low intensity range to these moderate to high intensity range. That's the area that cardiac rehab will push you. And you might be in cardiac rehab for 3 months, but I would highly, highly recommend if you had an open heart surgery that you do cardiac rehab, first of all, and that you do it for as long as you can. Not only is that going to help you performance-wise, and so it's going to help you to get your fitness level, or help you push, not get your fitness level, but push you in a fitness direction. But it's going to help your conditioning. It's going to help your stamina. It's going to help you to progress all that. But it also is going to help with fear. That, I think, is a huge component for patients after these types of surgeries, because a lot of times they're not sure exactly what they can get back to doing. They're not sure, how hard can I work? If I work too hard, am I going to have a heart attack, or what is going to happen here? What can my heart tolerate? Well, that's what cardiac rehab can help you to investigate, and then it can help you to alleviate the fear that can be a part of these types of surgeries. So highly, highly recommend that you be planning, if you've recently had open heart, or if one of your family members has, that you're planning to schedule and get into cardiac rehab so that you can more fully go through your therapy and recovery. And then after cardiac rehab, as I say, you can do that generally out to about 3 months or so. Then I would plan to bounce myself into a gym membership and then performing consistent daily cardio exercise, strength training exercise, and I would work on getting yourself into the best shape of your life. And I would make fitness work, a part of your complete future for the rest of your life. I would completely change what it is that you had been doing beforehand. And if you had led a sedentary lifestyle, that is, and then turn your lifestyle into one that incorporates fitness on at least the majority of the days of the week, and continue progressing yourself at that point. But these are all sort of the discussions that I typically would have with my patients when I was in home health physical therapy. So I hope that this has maybe answered some questions for you. Hopefully this has given you a little bit of guidance so that you can understand more as far as what to do and why you should be doing it. If you have any questions or comments, please comment to below on this video, and I'd look at all of those, and I'll give you the best feedback that I can. If you like this video, please give this a thumbs up. If you haven't already, do subscribe to the channel. We are growing, but this is still a very new channel, and so every subscriber is beneficial to us. So I hope that this has been able to provide some information and shed some light on the recovery that you would go through after having an open heart surgery, and what kind of your physical therapy and rehab process is going to look like. All right. We'll be saying prayers for you if you are one of those patients that has had these surgeries, or if you have a family member do so, and we hope that they or you recover very quickly. All right. Y'all have a good one. Later.